Hello friends, this is another shortcut video to help you with your documentation in Meditech. Today we're going to talk about the discharge workflow. Now if you're a primary service provider, you know this routine backwards and forwards, but if you're a consultant, you might not have a lot of experience or time dealing with the discharge workflow, especially if you do not primarily admit patients to the hospital. The discharge workflow consists of several items that need to be filled out as far as the patient's discharge medications, any labs, tests, or discharge referrals. Now, if you're a consultant, say a GI specialist or a cardiologist or infection prevention specialist, and you know what you want your patient to have at discharge, there is nothing stopping you from going into any one of these tabs and adding whatever content you feel the patient will need at discharge. This can be done at any point in the patient's hospitalization and will start that day one when the patient is discharged. So the clock doesn't really start on any of these discharge medications until that patient's information has been finalized. So there are ways that you can assist the primary service if you are not the primary admitter to the hospital for this patient. So if you know you want to see this patient after discharge within a week, you can certainly select the referral tab, go in and select refer to me, and that's going to create a referral for that patient. It's going to print out associated with, say, their pneumonia. And it defaults to within 1 day, but you can certainly say within however many days you would like to see this patient. Save that information, and then it will populate, once you pin it, to the discharge workflow. This allows the patient to know exactly what you're thinking as far as when you want to see them again, and also really helps that primary service know what you're thinking and when you want to see that patient again. So please do consider using these tabs. You can also select laboratory studies. If you don't find what you're looking for on this page, you can certainly hit the category button and then go in and select whatever therapies, imaging, laboratory studies that your patient requires. Cardiac rehab is also a selection in here, so if you want that patient to start cardiac rehab within 60 days, however long, you can certainly select that and associate it with the diagnosis appropriate for that referral. So please consider using this workflow to assist your colleagues and also to communicate clearly to your patient as to what they'll need post-discharge. Thank you for listening and have a good day.